From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is healthy communities. Bon Secours Strategic Quality Plan sees healthy communities as a good place to live for residents. Specifically, the rich diversity of cultures and capacities of the community are celebrated and mobilized with a particular concern for those who are poor, marginalized, and dying to create physical and social environments that promote families, nurture youth, and support senior citizens. Individuals have the opportunity to fully participate in defining holistic well-being for the development of their innate potential. And one of our goals is bringing our communities to wholeness. Another is transform our health delivery. So, where am I going with this? Good question. Recently, Bon Secours Baltimore announced they were playing a leadership role in one of 5 newly formed zones in Maryland created to focus on health in poor neighborhoods. So, why is that important? Another good question. Did you know that nearly 10,000 people in West Baltimore alone are newly diagnosed each year with diabetes, hypertension, and other treatable chronic health conditions? Well, it's true. Did you also know that these illnesses will disable or kill many of them because they do not get proper medical care? Also true. Enter the West Baltimore Primary Care Access Coalition, a coalition of 16 hospitals and nonprofit organizations designed to fill that need and help bring good help to the West Baltimore area. And Bon Secours Baltimore is playing a leadership role in that coalition. These health enterprise zones are designed to curb health disparities in the state as part of a state program that plans to allocate $4 million annually over 4 years to each zone. The West Baltimore Primary Care Coalition plans to use some of that money to attract primary care doctors and nurse practitioners by offering $25,000 toward repaying their student loans, as well as hiring 11 community workers and developing other health-related efforts. According to Greg Kearns, Director of Strategic Management at Bon Secours Baltimore, we want to get people the care they need so we can keep them out of the hospital. The West Baltimore Primary Care Coalition hopes to help transform these poor neighborhoods into healthy communities. But Bon Secours Baltimore and the state of Maryland know we cannot do it alone. So, by helping to build this partnership, the coalition is taking the first step to building a healthy community. And that, my friends, is the backbone of our Strategic Quality Plan, Building Healthy Communities. Bon Secours Baltimore and the state of Maryland and the West Baltimore Primary Care Coalition, transforming the way we deliver care and bringing our communities to wholeness. In other news, for the past 4 weeks, we've been running through the goals of Bon Secours' Strategic Quality Plan. Today marks the last installment in that series. The goal is liberate our people's potential, and there are 2 sub-goals under that: engage those who serve with us and foster employee well-being, body, mind, spirit. Here's CEO Rich Statuto to talk a little bit about what that means.
And then last but not least are liberating our people's potential, making sure that those we depend on are engaged and we're matching their skills and interests with the needs of the organization and the communities we serve. So you need to be in constant dialogue with each individual to say what's important to you, how does it fit with where we're going, and to create longer-term plans for their career development within the organization. And then our last measurement that we talked about was making sure that we're fostering all of our well-being, body, mind, and spirit. And so we want to be welcoming of all faiths, but we want to provide opportunities for everybody to practice their beliefs and make sure that they're reaching their full potential. One of the things we talk about is our personal health assessments. I don't think that gets at the spiritual component, but it does get at some of the mind and body. And so we'll be looking for other areas that we can measure in terms of our embracing and enhancing all 3, body, mind, and spirit.
Bon Secours Strategic Quality Plan, liberating our people's potential through engagement and well-being. Finally, palliative care plays an important role in Bon Secours Strategic Quality Plan. Specifically, under the goal, ensure our care is extraordinary, there is a sub-goal, provide unparalleled palliative care. And Bon Secours Chever's Director of Social Work, Jennifer Giuffrida, takes that goal seriously. Jennifer was recently selected for the 2013 Social Work, Hospice, and Palliative Care Network's Award of Excellence in Clinical Practice for her work in the palliative care arena. We had a chance to sit down with Jennifer before she received the award to talk a little bit about palliative care and discovered that she is passionate about her work. Here's Jennifer Giuffrida, Director of Social Work at Bon Secours New York Health System.
I'm Jennifer Giuffrida. I'm the Director of Social Work and Therapeutic Recreation. When we've recognized that a resident has a diagnosis of less than 6 months to live, we will talk to the resident and the family about hospice. We do have a hospice agency that comes in and provides those services to us, and oftentimes it's the extra aid hours that the family is really in agreement with, because it kind of gives them peace of mind to know that there's someone with them for some extra hand-holding and extra companionship during the day while the family members are out at work or busy doing their own thing, to know that someone's there with mom or dad or whoever. And you know, we've really had some remarkable, and if I can say so, peaceful deaths here at Chever. Really wonderful times where families are allowed to stay overnight, to sit with them when we know that the end is imminent. We've allowed for a lot of, you know, family members to be involved in that process as much as they want to be. You know, we've gone so far as to involve them in demonstrating care. You know, there's a lot of mouth care that goes on at the end of life, and the family member feels really involved as a caretaker, and it means a lot to them. We have cots that we bring in and allow for spouses or children or next of kins to sleep at the bedside with them. Whatever the family needs and wants, we work to provide for them, because we understand that this is a really important time of their life, and they're going to remember this for a very, very long time. So we're very, very sensitive to those requests. It's a very strong mission that we have here. Never before have I been employed with a company or an agency that has such a strong mission statement. And as an advocate of palliative care, I believe in the concept, I believe in the philosophy behind it. In our mission statement, it says, especially those who are poor and dying. And that means everything to me.
Jennifer was nominated by her peers, and the Award of Excellence in Clinical Practice from the Social Work, Hospice, and Palliative Care Network recognizes her outstanding leadership in developing effective and widely accepted palliative services. She successfully engaged patients, families, and the entire community of professionals in learning about the values and processes of a palliative approach. Her efforts showed impressive results, including a reduction of hospitalization rates following early identification of problems, discussion of goals of care with families, and an increase in patients on palliative care services who receive enriched support, all leading to more comfortable and dignified deaths in the nursing home. Please join us in recognition of Jennifer's many contributions to palliative care and in congratulating her on receiving the Award of Excellence in Clinical Practice from the Social Work, Hospice, and Palliative Care Network. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.